We'll start. Tell me when no.
Yep.
Ready to go? Okay. So today we're going to demonstrate how we give ourselves an IM shot. In this particular case, it's for testosterone, but it could be for most anything. And we start with a syringe. This is a 3cc syringe. It's already got a needle on it. You turn this thing over, it'll tell you the size of the needle. This particular case is 25 millimeters. 25 millimeters long, anyway. And it says it's 23 gauge. That's a common gauge for the needle. It's big enough to draw through, but not so small that it's difficult. So a 25 gauge is actually smaller bore than the 23 gauge. So the higher the number, the smaller the bore. So this is a 23 gauge. So a 21 gauge would be even bigger around, making it even easier to draw, but we don't need to use a 21 gauge. So here is the package. And right at the hub is where you peel away the package to give you access to the syringe. And this, once we've done that, we can just kind of toss. But the needle is screwed on with a sheath to protect it. But it's screwed on very loose. It's easy to take that needle off. But we're going to put a little twist to make sure it's on there nice and snug. Okay. The next thing that we're going to do is we're going to take our little, in this case it's a 1cc vial of testosterone. We've already used a half of a cc. In this particular case, we're using a half a cc dosages once a week. And so that half a cc has to be replaced with a half a cc air. So I always put in a half a cc air before drawing out the half a cc liquid, because if I don't put the air in there, I'm going to be developing an increasing vacuum. It's going to make it harder and harder to pull stuff out. So I always start with putting in the amount of air that I'm going to be pulling out in terms of fluid. So I'm going to take my little alcohol swab, just tear it off, pull it out, and I set it down. It is the wrapper down. I take this little bottle and I clean off the top to sterilize the top with the alcohol. Then I put the alcohol pad right down on its little container there, because I'm going to be using that later on to clean up the leg. And then I'm going to set that down for a moment. Make sure that I'm not touching that because I've just sterilized that. Make sure the needle is on nice and snug, and then the sheath just pulls directly out. Okay? If I wanted to put the sheath back on again, there's a preferred way to do it, which is going to be the same way that I'm going to be drawing from that you'll see. So I hold the sheath between my thumb and index fingers, and I put my middle finger down on the base there, and I hold the syringe in my right hand if I'm right-handed. Of course, you flip all this over if you're left-handed. I'm going to hold it with my index, middle, and ring fingers, and thumb on the top. I'll put those three fingers down on the edge of my palm. And so now, I'm going to direct right toward the sheath. So now I've got a secure way of doing this to get away from the jitters that some people have that may end up sticking themselves, or they may contaminate the needle because they missed the hole. So I've got three fingers down, I'm holding it like this, and then I've got precise control, and I can put that thing right dead center to resheath this thing. Okay? What I'm going to do when I have it unsheathed, I'm going to keep the sheath on it because I'm just going to show how I'm going to do this. So I'm going to pull a half a cc of air into this. Now, Chad, make sure you can see the numbers. Can you see that?
Mm-hmm.
All right, so that's 1 cc. That's exactly a half a cc. Each little line is 1/10 of a cc. So that's 1/10. Make sure you can see that, Chad. That's 1/10, 2/10, 3/10, 4/10, 5/10, or a half, 6, 7, 8, 9, and 10/10 or 1 cc. So usually we're going to be using a half a cc. Sometimes we're going to be using half of that. In other words, a quarter of a cc. If it's a quarter of a cc, it's going to be half of this, half a cc, or 2.5 of those little lines. So there's 1, there's 2, and there's about a half. Okay, can you see that, Chad?
Mm-hmm.
All right. That's for those people who are only using a quarter of a cc. Sometimes we'll do that twice a week. So that's how you pull that out, okay? In his particular case, we're using a half, okay? So we already got this thing cleaned off. I'm going to take the sheath off of it. I'm going to hold this little bottle the same way I held the sheath. My thumb and 2 fingers. And this, I'm going to hold just like I held the syringe when I was playing with the sheath. I'm going to stick that thing right in the center. And you're going to turn that off. We're going to have no conversations in the middle of this. There we go. Should preferably turn it off because they're going to probably try to call you back. So I'm going to hit this thing dead center. Now I'm going to squirt that half a cc of air into the vial, and then I'm going to watch the tip of the needle. I want to be able to see the tip of the needle through that liquid at the bottom. Now you might not be able to see that with the video, but just understand that I'm always aware of where the tip of the needle is. And so when I'm trying to draw the last few little drops out, I'm going to have to get that tip underneath the surface of that little plunger, which is, or that stopper cock, which is, it's in this kind of a shape. So I'm going to have to pull that needle down below the edge here in order to get those last few little drops. So I can see where the needle is. I squirted in my air, and now I'm going to be resting the syringe on my hand like this. I'm going to rotate it over. I'm going to put my index finger right on the hub. And then I'm going to put my thumb and middle finger on the plunger. I'm going to push on the hub and pull on the plunger at the same time, making sure that I got the needle always under the surface of the liquid. Otherwise, you're going to be pulling air out of there. So here we go. I'm going to pull this thing all the way down to about maybe 2 cc's worth of negative pressure. And you can see that liquid rising up through there. And I've got about a half a cc. Let's see. Maybe slightly. Get rid of that air. Watch the tip of the needle. Make sure it's underneath the surface of the liquid. The needle might not be on there quite strong enough. Let's give it a twist. There was a little bit of slack because I think when I was pulling a little bit of air, and that might have been pulling it because the needle was a little bit on there loose. So that was kind of instructive for everybody. If you end up pulling air when you shouldn't be, that could be the reason why. So this is the second half a cc. So this should get rid of all of the testosterone in here. So I want to pull that needle with negative pressure on it all the way out until it comes out. That way I get the last little drop. So as that needle is dropping below the margin of that little rubber cork, I can't see the needle so much anymore, but I keep pulling on this as I'm slowly withdrawing, and that allows me to get those last few drops, okay? Now, when you look here, you see I got a bunch of air in there. I've got a half a cc of liquid, but I got about a cc worth of air in there. No big deal. Just squirt out the air. And now we've got exactly a half a cc of liquid. And I like to pull in maybe a couple of tenths or so of air. Why do I do that? Because I want to get every last little drop inside in the shot. Because when we turn that thing upside down, which is going to be the position it's going to be in when you're giving the shot, the air bubble goes to the top. And the last thing that's going to go through that needle is going to be the air bubble, which is going to flush the needle of any testosterone so that we don't waste any testosterone, okay? You don't have to worry about getting air that's going to cause some kind of an air embolism, whatever. That only happens if you get it into a major artery or a major vein, and that doesn't happen on the outside of your thigh, which is where we're gonna give the shot. Okay, so that's exactly where we want it to be. I'm gonna put the sheath back on here again. Remember how I did that? I'm gonna hold it between these two fingers and my thumb, put my 3 fingers down, and aim right in the middle to make sure that I don't contaminate this. Then just set this down until I'm ready for it. Okay, so the next thing I'm gonna do is, if I'm wearing shorts, I just pull the shorts up. Let's just pretend like I'm wearing shorts. So I'm going to be pulling the shorts up. And we're going to give ourselves a shot someplace between here and here on the outer portion of the thigh. And you can go as high as the midline, but don't go past the midline, because all of the important big arteries and veins and nerves are over here. So if we stay at the top or over to the side, we're going to be safe. So we take our alcohol swab again, and we find a little spot on our thigh, and we clean it off. You can look for little freckles, or you can take your little ink pen and put a little X, and just remember that my spot is maybe 1 inch or 2 inches over in a certain direction from where that X is. So when you take your eyes off it, you're not going to forget where you cleaned it off. Okay, so I got that thing cleaned off. I'm going to take a tissue paper. I'm going to put it in my left hand if I'm right-handed. If I'm left-handed, everything is switched, because we're going to go on the left leg if we're left-handed. Okay. Tissue paper right here. I'm going to get my syringe. It's like throwing darts. Okay. I'm going to put my left hand down securely on my thigh, and my left thumb is going to be up, and I'm going to put it right in the crux of the palm to help give me a little bit of a spring kind of an action here to help. It's going to help control this thing, because I don't want this thing moving around much. And so we're making sure that we're aiming toward the right spot that we just cleaned off. It's like 1, 2, 3, and pop. We want this thing to go in fast. And how deep is going to depend upon how much fat you got on your thigh. If you have very little fat, you probably only need to go about maybe half the length of this needle. If you got a lot of fat, then you might want to go 3/4 or the full length of the needle. Okay. Once you got it in there, if you didn't get it in deep enough, and the people don't get it in deep enough, do that because they're a little bit nervous, especially if they've not done this before. And so they're kind of hesitant, and then they're shaking and whatever, and they can, and then they kind of put it in a little bit. Well, it doesn't hurt if you put it in fast. If you put it in slow, you're going to feel it more. And if it's bouncing around because you got a nervous hand, it's lacerating muscle. It's going to cause the muscle to bleed. And bleeding muscle is going to cause a hematoma sometimes, and the hematoma may hurt for 4 or 5 days. So if it hurts in there the following day, it's because you didn't stabilize the needle. So we pop that thing in there. Your thumb is stabilized underneath your hand. You pop it in there, get it the proper depth. If it's not deep enough, then every movement is a pop, 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 a quick movement. You don't slide. If you slide it, you feel it more, okay? So if sticking that needle in hurt, it's because you put it in too slow. You kind of slid it in nice and slow and easy, and you're going to feel that. If you do this thing right, you shouldn't feel it at all, okay? So once you got that thing in the proper depth, and you reach over with your thumb and index finger to hold that thing nice and firm so it doesn't move. You don't want it moving in and out. You don't want it going side to side. And so you keep your hand on your thigh, and you're stabilizing this thing with your left hand, thumb and index finger. But you want to be able to look through the 2 fingers so you can see exactly how much you got left, how much you need to get out of there, okay? Then you grab a hold of this thing by the hub and your thumb on the plunger, and then you just squirt that thing in. It's not going to take much because it's only half a cc. Okay, when it's all in, then you pop it out just as fast as you popped it in, and you take your tissue paper and you put that over the little poke hole. You put there nice and firm with your thumb for about maybe 30 seconds until you then leave up on it, and you look if there's any kind of oozing at all in the injection site. You just put the tissue paper back over there with some more pressure for another 30 seconds. Every once in a while, you might hit a larger little blood vessel, and it might want to bleed more. That's no big deal. You just put pressure on it. It always stops. It always stops. Sometimes you might even, every once in a while, rarely, you might hit a little artery that's kind of going through that area, and you might notice that it spurts just a little bit. If it spurts, it's probably a little artery. No big deal. You just put pressure on it. It always stops. It always stops. Okay. So after about 30 seconds, you lift it up. If it's still oozing, you give it another 30 seconds. You lift it up. If it's not oozing anymore, good. You're done. You're done. And then you pick up the sheath, and you do the same thing we talked about before. So you hold the sheath in your hand like this, and you resheath this thing, holding it just like I'm showing you. Get it in there, and you're good to go. And then this thing, you take the needle off, you throw the syringe away in the trash, and you throw the needle with the sheath on it into a baggie of sorts. You put all your used needles in the baggie, and when you come back to the office, you bring the baggie in, and we toss it up into our red disposal can. And that's it. That's it. Okay.